itching and burning, itching and burning, itching and burning. Stanky fishy, stanky fishy, stanky fishy. I got STDs. They make my coochie itch.
Hey guys, we're Penn State nursing students, and today we're going to be talking to you about STDs, which are sexually transmitted diseases. You may also hear them referred to as STIs, which means sexually transmitted infections. There are a lot of misconceptions about STDs, like you might think that blue waffle is a thing, or you might be scared to sit on the same toilet seat as someone who has an STD. Or you might think that someone who has an STD is a slut, but these are all incorrect things, and that's why we're here to talk to you today.
STDs or STIs are infections that can be spread through sexual contact, which means oral, vaginal, or anal sex. They are caused by bacteria, viruses, and even parasites. Most of the time, there are no presenting symptoms, so they go unknown. This is why getting tested and practicing safe sex is crucial. While STDs may not seem scary since there can be no side effects, they can have serious long-term consequences, like infertility and decreasing the body's ability to fight off infections. Luckily, most STDs are easy to treat. Now we're going to talk about some of the more common STDs, which you have likely heard of before.
Gonorrhea, chlamydia, and syphilis are all bacterial infections that can be spread through oral, vaginal, or anal sex. They cannot be spread through casual contact, which means spending time around each other, sharing food, or kissing. Symptoms of these STDs include pain or difficulty peeing, unusual discharge, soreness, bleeding, rashes, itching and burning, or sores. They can be tested either with a urine test or by doing swabs of the infected area. The treatment for these STDs is usually just antibiotics. Remember, when you're giving antibiotics, it's important to take the full dose given to you by your doctor, and don't just stop taking them when you start to feel better or symptoms go away.
Herpes is a viral infection and it has two types. Type 1 is oral herpes and type 2 is genital herpes. Genital herpes can be spread through vaginal, anal, or oral sex, while oral herpes can be spread through contact with an infected person's saliva or cold sore. Type 1 can be given to someone as type 2 and vice versa. For example, if someone with oral herpes has oral sex with someone, the other person can get genital herpes. Herpes usually results in blisters that burst and turn into sores, and an infected person may experience flu-like symptoms such as achy pains. Doctors usually can tell if you have herpes just by looking. While there are no cures for herpes, symptoms can be controlled with medicine.
Pubic lice, also known as crabs, is similar to head lice. It's small parasites attached to pubic hair and can be found on other places where hair is found on the body, like armpits, beards, or eyebrows. It's spread through sexual contact as well as close personal contact, much like head lice. It can be spread through articles of clothing, sheets, or towels that have been used by an infested person. To get pubic lice off of garments, use the hot setting on your washing machine to wash and clean them. The symptoms for pubic lice are intense itching and possibly seeing the crawling lice. It can be treated with over-the-counter lice treatments like RID and Nix. If those aren't effective, you can see a doctor to prescribe stronger medication. Condoms and dental dams can't prevent pubic lice, so it's important to avoid sexual contact with someone who has pubic lice until they have completed their treatment.
HIV is a virus that can lead to AIDS. HIV is spread through vaginal and anal sex. It cannot be spread through kissing, sharing food, holding hands, or any other form of casual contact. It can also be spread through sharing needles. HIV breaks down your immune system, which means an infected person gets sick easier and can die from infections they would normally be able to fight off. People with HIV can go years without any obvious symptoms and may not know they have it. If HIV goes untreated for too long, it can cause AIDS. This is why it's very important to get regularly tested. There is no cure for HIV, but medication can help people have a long, healthy life.
HPV or human papillomavirus is the most common STD. There are hundreds of types and around 40 can be sexually transmitted. Most people are unaware that they have HPV because there are no presenting symptoms, so they feel normal. This is why it's important to get tested regardless if you have symptoms or not. HPV is spread through sexual skin-to-skin contact, which is when someone's genitals or anus touches someone else's genitals, anus, or mouth. This means HPV cannot be prevented using condoms. Some types of HPV can lead to genital warts or even certain types of cancer. There are vaccines that can prevent certain types of HPV, along with available treatment for HPV before it starts mutating into cancer.
You may be wondering how you can prevent getting an STD. Step 1 in prevention is to talk to your partner before you begin to engage in sexual activity. If you feel uncomfortable talking with your partner about this topic, or your partner refuses to give you an answer and shames you for asking, you might want to reconsider whether you should be engaging in sexual activity with them at this point. Step 2 in prevention is to use barrier contraceptives, like condoms and dental dams. Here's a video on how to put a condom on.
This is a condom demonstration. People use condoms to lower the risk of STIs and pregnancy. It is important to put a condom on before you have any sexual contact. This type of condom can be used for any type of sex with a penis. There are lots of different condoms to choose from. If someone is allergic to latex, they can use a latex-free condom. Any condom that says it protects against pregnancy, STIs, and HIV is made out of a material that works. Before using a condom, there are 2 things to check. The first is the expiry date. Condoms break down over time. Check the expiry date printed on the condom package or on the box. This one has not expired yet, so it would be good to use today. The second thing to check is that the package does not have any holes and that it looks like it's in good condition. To do this, squeeze the package and make sure you feel for a pocket of air, like a bag of chips. That shows there are no holes in the package. Now is a good time for a reminder. Condoms need careful storage. They are sensitive to heat, cold, folding, sunlight, and rubbing. I am now ready to open the condom package. To open a condom, push the condom over to one side and then rip down the other side of the package. Be careful. Fingernails and jewelry can damage condoms. Never use teeth or scissors to open a condom package. Condoms sometimes come with lubricant already on them, and you can add more water-based or silicone-based lubricant if you want. Anything with oil in it will break a condom, such as body lotion. When you look at a condom, you can see that the tip can be pushed through either way, but there is a right way and a wrong way to put on a condom. When you look carefully at a rolled-up condom, you can see a crease where the condom is rolled up on itself. If the condom is on the penis correctly, you will see the crease folding in and around the tip. An easy way to remember which way the condom should go on the penis is that it looks something like a sombrero. I'm going to use my fingers to simulate a penis. As I place the condom on the end of the erect penis, I'm going to pinch the tip. The tip of the condom gives space for semen, or some people call it cum. It's important that there is space at the tip of the condom, otherwise the condom could break. Squeezing air out of the tip is what makes room for the ejaculated semen. I keep it pinched and roll the condom down. With a real penis, I would use 2 hands to pinch and roll, all the way down to the base of the penis. Now the condom is on the penis correctly and you are ready for sexual activity. After ejaculation, while the penis is still hard, hold on to the base of the condom and pull out from the body. Then carefully remove the condom and tie it in a knot. Throw the condom in the garbage, not in the toilet, because it can clog your toilet or wreck your septic system. Use condoms one at a time and use a new condom each time you have sex or switch sexual activities, like going from anal sex to vaginal sex. Practicing safer sex is all about protection, consent, and communication.
And here's a video on how to make a dental dam.
This is a dental dam demonstration. A dental dam is a piece of material that lowers the risk of STIs during oral sex on a vulva or anus by providing a barrier between one partner's vulva or anus and the other partner's mouth. It can be quick and easy to make a dental dam. You will need 1 condom and 1 pair of scissors. If someone is allergic to latex, they can use a latex-free condom. Any condom that says it protects against pregnancy, STIs, and HIV is made out of a material that works. Before using a condom, there are 2 things to check. The first is the expiry date. Condoms break down over time. Check the expiry date printed on the condom package or on the box. This one has not expired yet, so it would be good to use today. The second thing to check is that the package does not have any holes and that it looks like it's in good condition. To do this, squeeze the package and make sure to feel for a pocket of air, like a bag of chips. That shows there are no holes in the condom package. Now is a good time for a reminder. Condoms need careful storage. They are sensitive to heat, cold, folding, sunlight, and rubbing. I am now ready to open the condom package. To open a condom, push the condom over to one side and then rip down the other side of the package. Be careful. Fingernails and jewelry can damage condoms. Never use teeth or scissors to open a condom package. While the condom is still rolled up, cut the tip of the condom off. Keep the condom rolled up and put the scissors through the middle and cut through one side of the ring. Unroll the condom. You now have a rectangular piece of material to be spread out over a vulva or anus and act as a barrier. Place the dental dam over the vulva or anus. Lubricant can help the dental dam to stick to the skin so it stays in place. You can also hold it in place. It's important each partner only touches their own side of the dental dam. This way, each partner's skin and body fluids do not touch the other person's. After sex, carefully fold the dental dam up, only touching your own side. Throw it in the garbage, not in the toilet, because it can clog your toilet or wreck your septic system. Use dental dams one at a time and use a new dam each time you have sex. If you switch sexual activities, like going from oral sex on an anus to oral sex on a vulva, use a new dam. Remember, safer sex is all about protection, consent, and communication.
Barrier contraceptives are not effective at stopping the transmission of all diseases, which is why it's important to talk with your partner first.
Once you become sexually active, you should ideally get a sexual health checkup once a year. Females can go to a gynecologist, and any gender can talk with their regular doctor, go to a community health clinic, or visit their local Planned Parenthood. It's important during these checkups that you be completely honest with your doctor and nurse about your sexual history so they can better treat you. You may be wondering how you can get treated, especially as a minor. In most states, including here in Pennsylvania, it's legal for minors to get STD testing without parental consent. If you're worried about the test showing up on insurance bills, you can visit a clinic such as Planned Parenthood, where they will provide confidential STD testing and treatment. When you go for a sexual health checkup, a couple things happen. You'll be asked questions about your sexual history, and again, it's very important to be honest. Your doctors and nurses aren't there to judge you, they are there to help you be healthy. Next, you will have a physical examination. If you have a vagina, this means a pelvic exam and a breast exam. If you have a penis, this means a testicular exam. STD testing will be done either by peeing in a cup, a swab, or both. Sexual health checkups are no big deal, and everyone should be doing them at least once a year. STDs may seem scary, but if you use the information we taught you today correctly, they can be no big deal. They happen fairly often, so it's important to know the signs and get tested. Lastly, some things to remember. Blue waffle isn't real, toilet seats don't spread STDs, and just because someone has an STD doesn't mean they sleep around a lot. If you have any more questions, the Planned Parenthood site has a feature called Ask Rue that allows you to ask any awkward questions you may have in a completely confidential way. We hope you learned a lot today.
Itching and burning, itching and burning. Stanky and fishy, stanky and fishy. Fishy and stanky, fishy and stanky. I got STDs. They make my coochie itch.